Hi everyone, Aaron Brooks with Perfect Postures, and today we want to talk about orthotics and knee pain. We have a lot of clients that come in here that will bring their orthotics in, and quite often we'll take a look when we look at their posture with their orthotics in their shoes, and then we have them take their shoes off, and then we look at their posture again. And many times with knee pain in particular, they may see their podiatrist or the chiropractor, and they get a fitting for orthotics. And many times when you're dealing with knee pain, there's an association with a certain degree of pronation or a collapsing of the foot and basically the ankle joint, the subtalar joint. And this is our findings. Most times when we do an evaluation on someone and we have them put their orthotics in and we look at the foot and the ankle position, it does correct the foot and the ankle. However, what it doesn't do is address what the rotation of the knee, or in looking beyond that, what the rotation of the hip is doing. So for example, let's say that someone comes in, they have knee pain, and we note that their thigh bone or their hip is actually rotated inward too far. It's called internal rotation or a medial rotation. The orthotic, although it'll help the collapsing of the foot and the subtalar joint, it really doesn't help correct the position from the knee up, which is really important. That's your kinetic chain. And one way to use as an example is if you just stand there and then if you squeeze your butt muscles together, your larger glute muscles, you'll feel your feet actually come up a little bit, so you actually go into supination versus pronation. But what's the reason for that is that when you squeeze the glutes, the rotation of the hips are actually going external. So this is a perfect example of how strengthening the deep glute muscles will actually help affect the position of the knee, which will then actually help affect the position of the foot. So I'm not saying orthotics are a bad thing, because there's some really good things orthotics do, but when it comes to the kinetic chain, looking at the knee and even possibly the hip, I don't think it's the complete fix for those particular areas. So what we'd like to do with the corrective exercise is actually show you an exercise that we use quite often in here that'll actually help address that rotation of the hip, so that we can get the rotation of the hip to actually turn out, which will affect the position of the knee, which will then affect obviously the position of the foot and the ankle. So stay tuned for that, and again, if you have questions on our Facebook, please feel free to post them. Thank you.